Welcome back to the introductory session on health literacy. In video 4, I'm going to show you 3 examples of health environments and information. Some areas we will dive in a lot deeper during our live training session. However, I wanted to give you a brief overview to get you to start thinking about your environment and what may be helpful or not so helpful. Here we have a photo of a medical clinic waiting room. We have lots of posters full of eye-catching colours and information. There are lots of brochures available on different conditions that patients can take home and read at their own leisure. So what do you think? Is this helpful or not so helpful? Unfortunately, this setup is more likely to make someone feel overwhelmed. Yes, there is lots of information, which is great to provide. However, is someone likely to filter through all that information to find what they need? Is it better for the brochures to be with the health professional and they can provide the relevant ones during the consultation? Or maybe the number of brochures that are in the waiting room should be limited. Another thing to consider if you are going to display this many brochures is who is managing this area. Is anyone making sure the information is up to date? Are the brochures showing old dates or out-of-date statistics? Are recommendations on medications and management strategies still considered best practice? There are so many things that need to be considered with printed materials. Here we have signage for the front of a hospital. Take a moment to think about how helpful or unhelpful these signs might be. So this one is a great example. There is a language in addition to English, so they are already reaching another group of people who may not have understood the words if they were only in English. They have included visuals with the arrows to indicate which direction each department is, and the emergency section is in red, which is a common colouring for emergency. Here we have a brochure on dry eye. Putting aside the fact that we can't read the content, as that has been done deliberately for this exercise, do you think the brochure is helpful or unhelpful? So even when we can't read the information, we can straight away see a few issues with this brochure. Firstly, we can see that there are a lot of text-heavy paragraphs. Would this information be easier to read if it were broken up into dot points or more subheadings were used? Secondly, the information behind the text creates a challenging contrast between the text and the background. And lastly, how helpful are these images? What is their purpose? These are all things that we need to think about when presenting information, and we will go further into this during our live training session. I hope these pre-training videos have helped you have a better understanding of health literacy and the different aspects that can impact someone's health literacy levels. Before we meet for our live training, we would like you to have a think about your environment and how it may affect someone's health literacy. Now, this could be something positive that you find has been done really well, or it could be something that makes you think, could this have been done better? Or that was more complicated than it needed to be. Please don't limit yourself to things that can be physically changed. We acknowledge there are so many things such as building design that are beyond our control. However, we have some great tips on strategies that can be used to improve accessibility and the health literacy environment. If you could please write these observations down and bring them along to the training session, we would love to hear what you have noticed. Thank you for taking the time to watch these videos, and we look forward to seeing you soon.